Good evening, students. Today we will be dealing with the white matter of the cerebrum. So, in this class, we will be dealing with association fibers and commissural fibers. So, in the subsequent class, we will deal with the projection fibers. So, white matter is made up of central core of myelinated nerve fibers. It is classified into association fibers, commissural fibers, and projection fibers. Association fibers interconnect cortical sites lying within one hemisphere. They are short and long. You can see these are association fibers. Commissural fibers connecting functionally related gyri on both hemispheres. You can see here this is the corpus callosum and this is the anterior commissure. Then the third type is the projection fibers connecting the cortex with the lower centers in thalamus, brainstem or spinal cord or vice versa. So they are of ascending and descending. You can see here these are the projection fibers. So these are the commissural fibers, these are the association fibers. Association fibers connect different parts of the cerebral cortex of same hemisphere. Two types: short association fibers connect adjacent gyri. Long association fibers connect gyri located at a distance from each other. Examples for long association fibers are cingulum, uncinate fasciculus, superior longitudinal bundle, inferior longitudinal bundle, fronto-occipital fasciculus, perpendicular fasciculus. You can see here, this is the cingulum which connects paraterminal gyrus with the uncus. You can see this is the uncinate fasciculus. So this is the superior longitudinal fasciculus. This is the inferior longitudinal fasciculus. This is the perpendicular fasciculus. And these are short association fibers. Cingulum, it is girdle shaped, located in cingulate gyrus, extends from paraterminal gyrus to uncus. It's a part of Pappas circuit of limbic system. You can see this is the cingulum. Uncinate fasciculus, it's a curved fiber bundle, connects inferior frontal gyrus and orbital gyrus to the hippocampal gyrus and amygdaloid nucleus, connects limbic areas of the cerebrum. This is the uncinate fasciculus. Superior longitudinal bundle, it's a long bundle, begins in frontal lobe, arches back via parietal lobe to reach occipital lobe. From occipital lobe it turns to the temporal lobe. It connects occipital lobe to frontal eye field. Then a part of the superior longitudinal bundle is the arcade fasciculus. It's a part of superior longitudinal bundle, connects temporal lobe and frontal lobe. So mainly it connects motor speech area to the sensory speech area. You can see this is the arcade fasciculus. And you can see here this is the superior longitudinal bundle. You can see here this is the perpendicular fasciculus, this is the inferior longitudinal bundle. So inferior longitudinal bundle connects occipital lobe to temporal lobe. Fronto-occipital fasciculus connects frontal, occipital and temporal lobe. So in the earlier diagram we didn't see this because it lies lateral to caudate nucleus and lies medial to superior longitudinal bundle, separated from it by corona radiata. So when we are seeing superior longitudinal bundle in the sagittal section, we will not be able to see the fronto-occipital fasciculus because we need to shift the plane medially. Then perpendicular fasciculus connects parietal lobe to the occipital lobe and to the posterior part of temporal lobe. You can see here this is the fronto-occipital bundle. So now we'll go ahead with the commissural fibers. They connect the same cortical areas of the two cerebral hemispheres. Same means like two identical cortical areas of both hemispheres are connected by the commissural fibers. You can see here this is the corpus callosum, the largest commissural fibers. So these are the few named commissures like corpus callosum, anterior commissure, posterior commissure, hippocampal commissure and habendular commissure. You can see here this is the corpus callosum. So here connecting the two crura of the fornix will be the hippocampal commissure. You can see this is the pineal gland. In relation to it, there will be an inferior stalk and a superior stalk. Superior stalk of pineal gland will have habendular commissure, whereas inferior stalk of pineal gland will have posterior commissure. And here you can see the anterior commissure, which is located in the upper part of the lamina terminalis. You can see this is the corpus callosum, and you can see this is the anterior commissure connecting the two temporal lobes. It looks like a cupid's bow. Anterior commissure connects right and left temporal lobes. Shape is cupid's bow. Crosses midline and upper part of lamina terminalis anterior to column of fornix. Posterior commissure located in inferior lamina of stalk of pineal gland. Fibers from pretectal nuclei are involved in pupillary light reflex. These fibers are crossing through the posterior commissure. They connect cranial nerve nuclei of 3, 4, 6, and 8. Habenlar commissure, located in superior lamina of the stalk of the pineal gland, connects habenlar nuclei. So these are concerned with integration of olfactory, visceral, and somatic afferent pathways of both sides. You can see here this is the anterior commissure, habenlar commissure, posterior commissure, corpus callosum. You can see here this is the septum pellucidum, this is the fornix. Hippocampal commissure, also called as commissure of fornix, connects one crura of fornix to the other crura before forming body, connects hippocampus of both sides. What is the importance of all these commissures? It is important for executing bilateral responses and also the learning process. You can see here this is the commissure of fornix. These are the two crura. So this is the body of fornix and these are the two columns of fornix. So two crura of the fornix are connected by the commissure of fornix, otherwise called hippocampal commissure. So now we'll be dealing with the most important of the commissural fibers, corpus callosum. It is located in the floor of the median longitudinal fissure, which also contains the anterior cerebral artery, falx cerebri, inferior sagittal sinus. So it is the largest commissure of brain, connects two cerebral hemispheres, four parts, rostrum, the thin part of the anterior end, which is prolonged posteriorly to continue with the lamina terminalis. You can see here. So this is the rostrum. You can see it is continuing with the lamina terminalis. Genu, curved anterior end of the corpus callosum. You can see here, this is the genu. Then body, which is arching posteriorly, and the splenium, thick posterior portion of the corpus callosum. So this is the body, and this is the splenium. The junction between body and splenium is called isthmus, which cannot be identified so accurately on the gross specimens. You can see here, this is the rostrum, genu, body, and splenium. The rostrum is so named for its resemblance to a bird beak. Relations, superior aspect is covered with indusium ricium. So this is most important. It's a rudimentary gray matter of dorsal hippocampus. And within this indusium ricium on either side, there will be medial and longitudinal striae. So the splenium is separated from superior collicula and pineal gland by a transverse fissure, which is giving passage to following structures like tila choroidal, third and lateral ventricles, posterior choroidal arteries. Internal cerebral veins leave through this fissure and unite to form great cerebral vein of Galen. Anterior and superior aspects of the corpus callosum are in close relation with the anterior cerebral vessels. Inferiorly, corpus callosum gives attachment to septum pellucidum anteriorly and fornix posteriorly. We have seen it in earlier diagram. You can see here. So this is the septum pellucidum and this is the fornix. You can see here. This is the inferior aspect of the corpus callosum, which is giving attachment to septum pellucidum anteriorly and fornix posteriorly. So rostrum and genu form the boundaries of anterior horn of the lateral ventricle, whereas body forms the roof of the central part of the lateral ventricle. You will understand these relations when we deal with the lateral ventricle class. So connections of corpus callosum. So it connects corresponding parts of the right and left cerebral hemispheres. So rostrum, the fibers passing through rostrum are the fibers which connect the orbital surfaces of frontal lobes. So genu, the fibers passing through it connects frontal lobes and looks like a fork called forceps minor. Splenium, fibers passing through it connect occipital lobes. Again, they look like a fork called as forceps major. So this forceps major fibers causes an elevation in medial wall of the posterior horn of lateral ventricle called bulb of posterior horn. And body, so large number of fibers intersect with corona radiata, which is a part of projection fibers, but few fibers which do not intersect with corona radiata and related to posterior and inferior horns of the lateral ventricles are called as tapetum. You can see here, this is the forceps minor. So here you can see this is the forceps major and these are the tapetum. Here see the fibers coming through the body of the corpus callosum, they are intersecting with the fibers of corona radiata, but here these fibers are not intersecting with the corona radiata. So these are the tapetum. You can see forceps minor, then these are the major fibers intersecting with corona radiata. You can see this is the tapetum and this is the forceps major. So what is the function? Connects identical areas of two sides of cerebrum, transmits information from left to right side, depends on handedness and dominance. So as right-handed people are more and they are left cerebral dominant, so the information from left is passed to the right. integrates information to process motor and sensory signals. There is role in eye movements and vision by connecting visual fields in both halves of the cerebrum. It also helps in relaying speech and other modalities and also plays role in attention, arousal, and cognition of individual. So arterial supply. So rostrum, genu, and body, which are the anterior parts, supplied by the anterior cerebral artery. Splenium, which is the posterior part, supplied by the posterior cerebral artery. So applied aspects called as split brain syndrome, otherwise called callosal syndrome. Congenital absence of corpus callosum. Two hemispheres are disconnected. Skill learned with one hand cannot be replicated by other hand. Corpus callosum surgically divided in intractable epilepsy to prevent transfer of impulse from irritable focus on one side to the other. So this is surgically dividing the corpus callosum as a treatment for intractable epilepsy. So then the symptoms from callosal syndrome are as follows: the hemialexia, where the person cannot read matter presented to them in left hemi visual field. Then left idiomotor aparaxia, not able to carry out work with left hand in response to verbal command. Then left agraphia, not able to write with left hand. Then left tactile anemia, not able to name object placed in left hand with eyes closed. So anatomical basis of all these symptoms is inability of the senses perceived by the left hemisphere to go to the right hemisphere through corpus callosum. Thank you.